My name's Rosanna and I have Crohn's disease. Crohn's disease, along with ulcerative colitis, are the two main forms of inflammatory bowel disease. Inflammatory bowel disease is a lifelong condition and currently has no cure. And I know firsthand the impact that this condition can have on every aspect of a patient's life and the lives of the families as well. For example, I had to give up my job as a secondary school teacher because of my illness. I've been in and out of hospital many times and I've even ended up having major surgery. I've had many different treatments for my Crohn's disease. Some have been more successful than others, and it's not unusual for IBD patients to respond differently to treatments, but we don't know why that is. That's one of the reasons we need more research into this area, and one of the reasons I'm keen to support researchers to use health data to look at this. This will also help future patients avoid the trial and error experience with different treatments that I've had over the years. There is no one-size-fits-all treatment for Crohn's disease or ulcerative colitis. What works for one patient doesn't work for another. However, we do know that if we can get patients onto the right treatments as quickly as possible, it can really reduce disease progression and reduce the likelihood of surgery. Developing individually tailored treatments using health data will help patients with long-term conditions to plan for the future and get on with the important things in their lives. Bringing together and using the health data that patients give their consent to use could really help researchers to develop a more detailed understanding of the very individual nature of Crohn's disease and ulcerative colitis. This could be really important for young people, for example. IBD is often diagnosed in adolescence, so if we can get young people onto the right treatments as quickly as possible, it could really reduce the disruptions to their education and career that often happens to people with long-term health conditions. I got involved as a patient representative in the Gut Reaction Hub because I know from my own experience and from talking to others that one of the most important things for patients is to feel that they're listened to and that their needs and priorities are at the forefront of new innovations into treatment and care. It's our data that's being used and we need to be sure that it's being treated with respect. From my work so far with the Gut Reaction Hub, I feel reassured that they do have patient and public voices at the heart of their strategy and are taking the steps necessary to keep our data secure and to protect our privacy. I've benefited from previous research into Crohn's disease, so giving consent for my data to be used in research in the future is a way of giving something back. Perhaps it could lead to new treatments and care strategies for future patients with inflammatory bowel disease.